You definitely know someone who has been injured playing a sport, or maybe even the person who got hurt. But everyone knows that practicing sports is essential for a healthy life and for quality aging, so giving up physical exercise is not an option. But since no one wants to get hurt, it's best to know the risks and prevent exercise-related injuries and accidents. If you want to play sports with more safety and quality, stay in this video and I'll tell you about the main injuries and how to prevent them. Pause for vignette. Most injuries that amateur athletes or professional practitioners suffer are due to repetitive efforts, direct trauma, as in the case of a foul in soccer, or, more commonly in untrained people, the lack of adequate physical preparation. In this video, I'm not going to focus so much on professional athletes. I'm going to talk more about amateur athletes and people who practice sports just to improve their health and quality of life. The first injury I want to talk about is the ankle sprain. This is a common injury in sports that involve sprinting or quick changes of direction, such as basketball, soccer, volleyball, beach tennis. An ankle sprain occurs when the ligaments around the ankle are stretched or torn, and it usually happens when the person steps false, turning the foot and stretching these ligaments very quickly and sharply. This can cause pain, swelling and difficulty walking, and it may even be necessary to immobilize the limb. In order to prevent the occurrence of this injury, it is important to use shoes that are appropriate for sports, with the right size and well adjusted to the foot. Avoid practicing the sport on uneven terrain with many holes and unevenness, and, above all, regularly strengthen with weight training so that the muscles can help the work of the ligaments. Secondly, we have tendinitis, which is inflammation of the tendon, causing signs such as pain, redness, swelling and increased local temperature to appear. This can occur in any tendon in the body, but is most common in the shoulder, elbow, wrist, knee, and ankle tendons, depending on the sport you play. But what do you mean repetitive efforts? Does it mean training every day? Not necessarily. A good example for this is a tennis player. During training, these players train specific moves repeatedly, for hours, until they reach the maximum number of hits, being able to perform the same movement hundreds of times in a matter of a few minutes, characterizing the repetitive strain that can lead to inflammation. This is more likely to happen, especially when the muscle is weak and the tendon needs to exert greater force than necessary for the movement, so you should already suspect that the prevention of these injuries is also to perform muscle strengthening. In addition, it is also important to always warm up the muscles before and cool down after sports practice. Thirdly, let's talk about strain, which happens when muscle fibers break, and strain is classified in degrees according to the amount of broken fibers. This occurs, mainly, when the practitioner performs an effort for which the body is not adequately prepared, because the muscle has a limited elastic capacity and, if this is exceeded, the muscle fibers distend and injury can occur. To avoid this injury, it is important to work hard on mobility and flexibility, so that the muscle, tendon and ligaments are increasingly able and adapted to stretch without causing injury. It is important to remember that distension and strain are similar, but they are not the same thing. The strain occurs in the muscle fibers and the strain occurs at the junction between the muscle and the tendon mainly. In fourth place comes the contusion, and you must already know about it, because it is quite common. It is a blunt, traumatic injury and happens due to direct trauma to the body, for example, in a tackle in soccer where two players bump into each other, or even more commonly, when we bump into something and the skin turns purple. This color change happens because the injury causes accumulation of blood in the surrounding tissues and causes local pain and edema, and the severity depends on the intensity of the trauma. This type of injury usually improves with time, application of cold compresses to the site and use of anti-inflammatory drugs, if indicated. Last but not least, I'm going to talk about a more specific and frequent injury, the rupture of the anterior cruciate ligament, ACL, which is the ligament in the photo, image 1. It passes through the inside of the knee and helps stabilize muscles and bones, as well as allowing the knee to be rotated. This is an injury that frequently occurs in contact sports such as football and basketball, but it can also occur, for example, in sports like beach tennis, which is practiced on irregular terrain and has a high impact on joints and ligaments, as athletes run explosively and stop abruptly. Injury to this ligament can cause pain, swelling and instability in the knee, often requiring surgery to reconstruct this ligament. To prevent this injury, it is important to be in good physical condition, practice mobility, flexibility and muscle strengthening exercises, in addition to, of course, being accompanied by a trained professional to help the practitioner to perform the proper technique in the sport practiced. All that said, you may have noticed that the basis for preventing injuries during sports practice is adequate physical preparation with the regular practice of muscle strengthening exercises. In addition, it is very important to follow up with physical education professionals, eventually in physiotherapists, to always evaluate performance and physical capacity, so that there is no joint overload and, thus, the risk of injuries decreases. If you have any questions, leave them in the comments and I'll get back to you as soon as possible. If this information was useful to you, like the video and share it with other people who may also be interested in the topic, so you can help our community and spread important information about health to the population. This also encourages us to always produce quality and safe content around here. If you don't want to miss the new videos that I'm going to publish on the channel, subscribe by clicking the red button. And if you want to sponsor our productions, click Become a Member. Here, Daniel Coriolano, big hug and see you in the next video. Until later.